Hello, everyone. We are online, and I'll give other attendees 2 more minutes the chance to join us before I start with our short webinar. Okay, let me start with a short introduction. My name is Gabriel Ellis. I'm a psychologist and psychotherapist residing in Warsaw in Poland. And the topic of today is how to deal with stress, anxiety, and panic attacks in stressful times. And obviously, we chose this topic due to current events because of the war in Ukraine and the refugees that have to escape the country, and the people concerned in the other European countries. Where I live in Poland, which is obviously a neighboring country to Ukraine, many people are concerned, are anxious that the conflict might escalate and might reach out into these neighboring countries, Poland, Hungary, the Baltic states, and so on. And because of that, I want to focus more on the extremes of the anxiety response, which is on panic. I hope there will be some valid information. I want to give practical advice, especially towards the end. And please use the chat possibility to formulate questions, to which I will have towards the end a few minutes to attend to. Okay, so the first question is obviously, what is panic, or what do we consider panic at all? Panic is a very quick alarm reaction of our system to react to a perceived emergency. This emergency can be perceived physiological. This is very often the case if we're not under specific circumstances like war, etc. So people often perceive a heightened heart rate, or they are out of breath or cannot catch breath. They might feel a pain in the chest, or they might feel a restlessness in their bodies, something, that might feel like a coffee overdose and so on, without any particular, intake of substances or something. So that alarms people and puts them into a state of panic. The perceived emergency can be also cognitive emotional, to feel lightheaded, to feel almost like one is about to faint, that there is a numbness, a dissociation from the events around us. So this is more on a cognitive emotional level. And obviously, the panic can also occur due to situational circumstances, a loss of a person, a dear one, a partner, if a job is at risk or a job is lost, if a considerable amount of money is lost, or if there is, as in our case today, if there is an ongoing war in a neighboring country. So the first part was that there was a perceived alarm, right? And what is the alarm reaction? The alarm reaction within us is conscious and unconscious. This will be relevant in my further descriptions afterwards. There is often a legitimate concern behind our reactions. It doesn't have to be that we, in the panic reaction, that we have a realistic understanding of what is going on, but the concern is such. So, for example, oh my God, what happens if, for example, the war spirals out of control and encompasses the neighboring countries? There is a legitimate concern there. There are the irrational elements of the alarm reaction, which is often catastrophizing. So something like, oh my God, this is the end. There's no way out. There's no way that we can escape this. There is a perceived loss of control often enough in the aspects of physiological and cognitive reactions that I mentioned before. So when my heart rate, for example, is rising, when I'm feeling that I cannot breathe anymore, then the perception is I cannot stop it. It becomes worse and worse until I eventually will have to faint or die. And the famous fear of the fear when it comes to panic, so that it doesn't stop at the one event. After I kind of lost control, so to speak, in one event, this is for many people such a scarring experience that they will be afraid that it might happen again, because in the first place there was no obvious trigger or an obvious solution for the situation, so that there is the concern that they might lose control again in the future, and that they will be helpless when that happens. So these are the broad kind of aspects that belong to the phenomenon of panic. Now, what is the problem with panic? Often enough, the problem with a panic reaction is that we unconsciously have formed a conviction, a panicky conviction. So that, for example, when we apply it again to the situation of war, that this is getting out of hand, this will affect me, this will affect my family, we have nowhere to go, there is no escape. So unconsciously, there is this doubt or real concern or fear or panic behind that. What we need to do, and now this relates both to professionals and to the individuals who are affected by the panic, is that we have to take this conviction behind it seriously and work with it. Ignoring it is pointless. And people who have gone through anxiety attacks or panic attacks know that it is of limited value to tell oneself that this is not true, I don't have to worry, and so on. And especially when it comes from other people who are worried about them. If I have a friend that went through a panic attack and I tell him, everything's going to be all right, don't worry about it, and so on, they will feel detached from me because they will think that I don't understand the severity of their situation. So to simplify, to play it down, to just console without offering anything else in return is usually pointless. What we have to do, however, is to stop feeding the panic, to stop feeding the triggering thoughts. What I mean with feeding is that we have to maintain a certain mental diet when it comes to which thoughts do we want to allow in our mind and nourish in our mind, and which one do you want to kind of let go and let pass. So, for example, I can, of course, remind myself every minute that the war might come, that I have no way of escaping, that my family is in danger. And with every new thought, even though it's the same, with every time that I let such a thought fester in my mind and grow, this thought will have a cognitive emotional effect. This will nourish the anxiety and it will nourish the panic. So I have to be very cautious about which thoughts do I allow in my mind, and how do I feed actually the panic reaction, and what should be a good mental diet, and accordingly, which thoughts do I have to stop, and fester into my mind all the time. So, with all that being said, finally, we have to come to a more realistic assessment of the whole situation and to offer to the unconscious a more wholesome conviction. I will come to the details in the following slides, but this is something very important to keep in mind. Behind our panic reactions, there is a certain, usually undifferentiated, usually vague, usually catastrophizing conviction. And this is the most important element that we have to tackle in order to, in the mid and long term, get rid of the panic reaction. Something else that is very important to keep in mind, and that is indeed in a problem, when we deal with panic, the panic kicks in very quickly. And this is surely to do with evolutionary aspects of this reaction. When there is imminent danger, when there is reason to be concerned about our lives, the lives of the ones that depend on us, we need to have access to a very quick flight or fight reaction, for example. But whatever we do in order to stop the panic reactions, for example, stop feeding it, or some relaxation methods that I will get into, this relaxation will take time. So there's a quick buildup, but whatever you do, even if it's effective, we have to be patient and to do what is right, so to say, and to give the relaxation effect its time. We cannot be too ambitious and too impatient with, I want something that works immediately. This will usually not happen. Okay, so step one. Step one is to check, investigate, and differentiate. Like I said, usually the panicky thoughts are vague, they are undifferentiated, and they are catastrophizing in their imagined effects. When it comes to normal panic reactions that we experience in normal times, but also now in war times when dealing with such a severe situation, we first of all have to check that we are physiologically okay. Um, this is a doubt that many people have when they show physiological reactions like heart palpitations, for example, and then get the idea that they might get a heart stroke. We cannot just tell people, we cannot just tell ourselves that we are fine and that this is just a mental issue. We actually have to be responsible and check with the doctors if there's indeed no physiological reason behind our physiological symptoms. So please go ahead and check your health first. Check the health of the people around you who have panic issues so that there is no medical condition that is eventually missed. Okay, now if we have basically ruled out that the majority of the panic reaction is of a physiological nature, so that there is a substantial aspect of a cognitive and mental issue there, we have to start investigating what the basic assumptions of the chain of thoughts is that ends up in the panic reaction. So we have to check which of our assumptions are correct and which of them are probable. For example, when we think about the war and we think, oh my God, the war will come to Europe, will come to Poland, will come to the Baltic states, and what do we do then, and so on, we have to ask ourselves, how realistic is it? Is it realistic that under the certain circumstances that I perceive today in the news, that from such a point, from such a situation, Putin will immediately go and strike an attack against other countries? We don't know, but probably not. So then we have to ask ourselves, in order to challenge this unconscious conviction in our mind, right? We have to ask ourselves, okay, so let me sit down, let me investigate, let me ask people who know, let me research among the professionals, what would be clearer signs for an attack that is close? And for example, if the international tensions would increase dramatically, and there are more, threat scenarios, if there are more kind of levels of alarm that are raised internationally, the if the agencies of the different countries, the information agencies, if they raise concern, if they tell the population to prepare. So there are many sensible aspects that I think will make a case much more probable, so that we should be able to let go of our undifferentiated idea of imminent danger and replace it with something more probable. At the same time, we have to understand, not only on the outside, but on the inside, what are the events that trigger my panic reaction. So when I investigate my last panic reaction, what was the chain of events that led to it? What were the thoughts that I had? What were the fears that I had? What was my daily situation? What happened in that moment? And so on. So that I understand that there is a logic to my panic reaction. So here we tackle two aspects. One is the conviction that kind of vaguely and an undifferentiated way lies behind the panic reaction. And the other one is the chain of events in that situation that leads to the actual panic reaction. Another aspect in this differentiation is to distinguish high risk from low risk scenarios. This goes back to what I mentioned before, to come up with different scenarios and blueprints for situations where I should be concerned and situations where I shouldn't be concerned. And this, of course, depends on the individual, and we all have the responsibility to kind of follow our kind of guts and be responsible with the assessment that we make. So there is no kind of clear, objective solution for that. But for me, I would develop a very specific scenario for what is a worse or worst case. So when do I allow myself to become really concerned? And then on the other hand, what are the positive scenarios under which circumstances do I not permit myself to go into catastrophic thinking? So what are the positive scenarios that are not compatible with the panic reaction? For example, I might say, as long as the parties are talking, as long as there are diplomatic relationships, for example, between Russia and other countries, Russia and Ukraine are talking, and so on. This is a scenario that I will perceive as not allowing the conclusion that the war will spread and thus put me and my family into immediate danger. So again, the principle is to differentiate it, to create very concrete scenarios that will determine under which situations I allow myself to be really concerned and under which other circumstances I don't. Second step is prepare. So I am taking, again, the principle is I'm taking seriously the assumption that my unconscious has, and I will not just dismiss it because that doesn't work with panic. So I take my worst and worst case scenarios, and then I prepare for them. So I'm not packing my bags and leave, but once I have figured out under which circumstances I would indeed consider to leave the country or go somewhere else and so on, then for that case, I prepare. And I do it concretely. I don't make it vaguely. So, for example, I might have relatives abroad, and I ask myself and I ask them, look, under these and these circumstances, could I come to you? Who should I inform? Who should I have to take with me? Family members, friends, and so on. What are the things to take with me? So documents, resources, etc. And how, when I'm away from my home, do I keep access to vital resources like bank accounts and so on? So we prepare for the worst. Why? Not necessarily because it's realistic, but because we want to put our unconscious, undifferentiated reflex, we want to satisfy that because it tells me prepare, prepare, prepare. So I'm preparing. The third step is to become aware of my panic response. So I have finished my scenario. I have prepared whatever needs to be prepared in a worst case scenario. And now I have satisfied my unconscious concern. And now I investigate my panic reaction. So I understand, like a scientist, I'm understanding under which circumstances does it appear. So that when the panic kicks in the next time, like for example, I wake up and the concern is overwhelming, I understand, oh, this is my panic kicking in, right? This is step one. Then I get these thoughts, then I get the fantasies, then I see an atomic cloud over my house exploding. Then I have those feelings kicking in. This is it. This is the panic response. I understand that. What I need to do is I have to become comfortable with uncomfortable feelings. The emotional panic response kicks in. At that moment, I have to understand these are just sensations, uncomfortable sensations. They will subside. Let me not feed it. Let me not pour oil into the fire. I will not trigger myself with again and again repeating the panicky thoughts, the fantasies that trigger me. I'm letting it go. I'm observing. I'm remaining calm. I'm not inviting bodily sensations and panicky thoughts into my system. I'm not becoming obsessive with how is my heart rate doing? How is my pulse doing? How is my nervousness doing? All these are kind of inviting bodily sensations into my mind, and this is not what I do. I disinvite them. After having had a few of those episodes, I can reliably say, I've been here before. I've survived this. I can stand the discomfort. Again, let me remain calm. Let me not feed it. Let me observe how the panic curve basically subsides. It's just adrenaline, and I wait patiently for it to clear my body. This is such a thought. Okay, 2 more slides about practical tips. One is breathing technique. The problematic breath is when we get into an anxious mode is we usually breathe too shallowly. We inhale more than we exhale. Some people hold the breath entirely, or they get into hyperventilation and breathe rapidly. So it's good for people who are prone to these kinds of anxiety and panic reactions to actually learn and exercise and practice a different breath, a relaxing breath, a deep breath into the belly to extend the breathing, the inhale and the exhale. And if you want to do something really nice for your body, learn the 4-7-8 breath, which means you count the breath, something like seconds. So you inhale for 4 seconds, you hold the breath for 7 seconds, and then you exhale for a longer time for about 8 seconds or 8 counts. Just as an example, it has been found that one relaxing aspect of smoking is actually the long exhalation. When you imagine that there's a short inhalation when people smoke, and then they exhale longer. So disregard the drug effect there. The way that people breathe when they smoke is actually an aspect that makes them relax. And the last one is what I recommend, a muscle relaxation technique, which is quite effective. You just have to use YouTube. There will be countless examples of guided progressive muscle relaxation videos and tapes, so PMR. This is a technique that basically does a body scan and lets you tense the most important muscles of your body and then relax them. And the effect is that after tensing, the relaxation, the mindfulness that gets along with that lets you have a muscle tone that is more relaxed than before you tense them. You can imagine, like, when you do intense sports, then afterwards the body's very relaxed. After yoga, the body's relaxed. And this is partly due to the tension that we inflicted on the body. So often these videos are anything between 7 and 20 minutes long, and they should give you relief in times when you are stressed. And even when you don't do it, after having practiced that for a while, of course, there's a practice effect, then you can quickly access this relaxation kind of mode of the body when you are in a stressful situation. Okay, thank you very much for your attention. That was a very quick overview about panic, its logic, and what we can do about it. Again, to summarize, there's a lot of cognitive work that we need to do in order to, first of all, take our concerns seriously, but then to differentiate them, work with scenarios, and then work on the cognitive and emotional level, and finally on the bodily level in order to help us to relax again. If you have any questions, we might have time maybe for 1 or 2 questions. Please use the possibility in the chat now. I see that someone has written. Let me just read it and then respond. Thank you for all the tips. Could you please talk a bit about survivor guilt? My family in Ukraine has been under direct attack for over a week. They are safe now. I'm helping them, but still feel guilty for not doing enough. So I work more, cheer them up, organize appointments for them, etc. But once I'm alone, anxiety is kicking in hard. Thank you. Okay, so just one aspect there. You, when you have this survival guilt, which is very common, so thank you for that. I'm sure it affects many, many, many people. Keep in mind that we are not at the end of this conflict. There is probably more to come, maybe in terms of refugees or, organizing structurally or infrastructure or logistics or, whatever it is. For whatever comes, we need to be fit. We cannot be burned out. To allow ourselves to get lost in the survivor guilt would mean that we harm our energy reserves. We don't feel better, obviously, with the survivor guilt. We feel worse. When we are worse, we are less able to handle stress. And ultimately, or very quickly, we are less able to support the people who need the support. So think about yourself, but think about yourself in order to eventually be more helpful for the people and for the tasks at hand. It's a functional approach. Of course, there's more depth to it, and it's more of a complex. There are more complex aspects about it. But my quick response is, you have to be mindful of your energies, and by allowing yourself to feel guilty, feeling depressed, feeling having all the second thoughts about not doing it enough, you are compromising your energies, and the effect of that would be that you have less available for the people in need. Okay, the second one is just a thank you. And let me end with this note. Thank you a lot for your attention. And again, all the best to you.